Malaria, a disease that I'm sure most of us in the class have heard of, be it through class or through TV or any of those things. But I think few of us understand just how far back its history goes. Malaria can be traced back to its early days in prehistoric Earth, where it affected early hominins and seems to have evolved alongside us, as we did.
Infection generally consists of recurrent attacks of moderate to severe shaking and chills, high fever, and sweating. Other symptoms may include headache, vomiting, and diarrhea. Dehydration and hardening of the spleen are the greatest factors regarding human mortality. Symptoms typically begin within a few weeks after receiving a bite from an infected mosquito. Certain types of malarial parasites have been known to remain dormant for much longer periods of time. Malaria is known as the great imitator in some medical circles, as its symptoms mimic those of more minor illnesses. However, malaria is a serious disease that requires immediate medical attention. Preventative measures in reducing malaria infections include bed nets, anti-malarial drugs, and residual insecticide spraying. Malaria infections require immediate medical treatment. Anti-malarial medications to treat parasites that form in the blood should be started right away. Any accompanying side effects should be treated, such as dehydration.
The cycle of transmission starts with the malaria parasite infecting humans and/or female mosquitoes. In humans, parasites grow in the liver cells and then attack the red cells of the blood. These parasites grow in the red cells and destroy them, releasing daughter parasites. When these parasites are in the blood, humans will start to feel symptoms. In mosquitoes, typically around 18 days, the parasite is found in the salivary glands. And when in contact with the human, the infection will start and spread in the liver cells, repeating the cycle.
When it comes to a malaria outbreak, there are a couple government agencies involved, one of them being the System-Wide Initiative on Malaria and Agricultural, also known as SIMA. This agency aims to make use of new and existing information on biomedical and socioeconomic determinants of malaria risks. SEMA works with International Water Management Institute, which is a non-profit organization that focuses on the sustainable use of water and land resources in developing countries. In terms of malaria outbreak, they claim that it is better to gain understanding of the influence that irrigation and agricultural activities have on the spread of malaria and other vector-borne diseases. This is because mosquitoes are becoming more resistant to pesticides and many drugs and are losing their effectiveness against malaria parasite. The CDC will work with these two organizations preventing worldwide spread.
Now, I suppose the question that persists in a lot of people's minds is then how do we best fight a parasite that has been around since, well, we have as early hominins? Currently, the mode of thought is that we could genetically modify mosquitoes and release them into the wild to breed out the population that causes the transmission of the parasite. But that causes a few implications to be thought of, such as the environmental impact of essentially destroying a species, even though it is harmful to humans. I suppose that's where we come to the biggest question that this class persists. In a One Health perspective, what else would this solution do to the ecosystem around us, and could it possibly cause issues in other aspects that could infringe on human disease? Well, I suppose that's up to you watching it.